Hi, I am Sharon Knight, President and CEO of Hope Communities, and I am so glad that you're here with us today on our Building Community Check-in. We at Hope Communities have always believed in the power of building community. We provide housing, educational programs, and support services for some of the most vulnerable people in Denver, and we've done that for 40 years. But we know that we are all stronger together if we can connect people in the neighborhoods and organizations in the neighborhoods and do really important work. So we started these shows when we started the quarantine because we knew that a lot more people were feeling isolated. They might not know where to get reliable information. And so we started this show 3 days a week at first. And the Facebook Live format was used because we know that people can write comments to us in the chat section of Facebook. And we can also provide links to things that we're talking about, so it makes it easier for you to access all the information you need right as we're speaking. We also know that some people watch this after we have gone live. There's a lot of people who refer. So if you hear anything today that you think someone in your neighborhood or someone in your network could benefit from, please let us know. I have a guest today, and I'm going to introduce her in a few minutes. But first, let me remind you that you can find lots of resources on our website, hopecommunities.org. And if you have any questions or if you need anything from us, please reach out to us with an email at info@hopecommunities.org. So we like to share a little bit of news about the virus or some of the resources available to you in the community, sometimes inspirational stories, sometimes activities that you can do at home, and we try to shape these around what we know our community really needs to hear. Today for news, I'm going to share from two of our top leadership and decision makers in Colorado. Mayor Hancock is really urging people not to be in large groups. He's very concerned that our rate of infections and hospitalizations is too high. The World Health Organization says that our positivity rate needs to be below 5% if we are to remain healthy and stay open, and we are currently at 4.6%. The number of cases resulting in hospitalization has steadily increased since June 27th. Here. So we have reached 72% of the capacity for hospitals at this point. And if we have a continued growth, that could be a real problem for us. So he really encourages us not to meet in big groups. The governor is also strongly encouraging mask wearing. He's not instituting a statewide mandate about that. And part of that is because we are so different across the state in terms of population and who we're exposed to, but he's really adamant that we should comply. And he provided a link to this really neat modeling website that shows the effect of several variables on the spread of COVID. And wearing masks, I did this earlier today, wearing masks makes a huge difference. And social distancing makes a huge difference. So we keep hammering those two things home on all of our shows, and please go on to that website. It is cucovid19.shinyapps.io/Colorado. It is a really, really cool website, so you can really see the effects of your actions on the spread of the virus. So now I'm ready to introduce our guest today. We have Brandy Kramer with us. Her official title is Project Shine Program Manager at Spring Institute, but I can tell you that she really is directing all of their community programs, and she has been a driving force in service for refugee families in Denver for many years, and an exceptional partner with Hope Communities in serving our families at the Hidden Brook location. So we're going to talk a little bit about the power of partnerships in leveraging resources and providing programs and services that are really impactful. First, thanks for being here, Brandy. I'm going to give you a quote to get us started because this is so important not only for this conversation, but what Hope believes. The quote is by Virgil Abloh, and it is, the whole point of collaboration is that you give and take from each other, and that's how you create things that are totally new. And I would add also totally better. So, we all can't do everything. And so having partners to leverage resources is so, so important. And we know we have a lot of clients with complex, both of us, both our organizations, complex challenges to contend with. And well, we have an amazing staff, for instance, we just can't do everything. And so we love partnering with Brandy and Spring Institute. So I'm just going to go on, and I really would love to have you tell us a little bit about your programs first. I mean, I know that we at Hope are really interested in providing ESL for our refugee clients, healthcare issues. We want to help kids. We want to help people with economic opportunity. But give me an overview of Spring and also some of those signature programs that you're working with right now.
Right. So Spring Institute offers many programs within the community and is always focusing on integration and making Denver a better place. And we love this city, and we know it wants to welcome refugees and immigrants. And how can we continue to make Denver a better city and state? Or Denver a better city, Colorado a better state. Some of the programs that we're offering at Hope right now are Ready Tots, and of course these things look a little bit different, but because of our great collaboration and the partnership that we have, these programs, the majority of them haven't stopped. They've changed a little bit, but through our partnerships and collaborating with different organizations, you said it exactly right. We're stronger together, and I think what I have really embraced through this pandemic and my work life is the purpose and the importance of partnering when serving the community. So one of our programs that is offered at Hope Communities is Ready Tots, and it works with your daytime caregivers, your FFNs, friends, family, and neighbors that are taking care of children, and your parents with children birth to age 4. By age 3, we like to see them in an early childhood education setting, and by age 4, we hope they're enrolled and going full time. That's one of the programs. It's changed a little bit during the pandemic. So I think when I talk about the programs, I'll talk about kind of how they've changed and what we're still doing. So I think we might have a chance to talk a little bit about our tent programming, but Ready Tots is now offered under a tent, and we're focusing on early childhood literacy and families staying healthy. And so moms, dads, whomever's taking care of the children are coming in to that programming under the tent and getting books and information that might help them as we all move through this pandemic together.
And Heidi Brown is the principal.
Heidi Brown is our coordinator. She's almost like the Pied Piper in the neighborhood.
I know.
Yeah, I think everyone knows her. Heidi, I hope you're watching. Thank you. And I think if some of the residents are watching, they absolutely know Heidi, and the children know Heidi. She's often there to meet them getting off the school bus. And we also have a cooking and nutrition class that's offered. That's a little bit on hold right now. But again, like you said, Sharon, thinking creatively on how can we do this and do it safely and appropriately, and listen to what your residents are saying. And so that makes me think a little bit about our senior programming, because tomorrow, if any residents are listening, under the tent programming starts at 10 o'clock in the gardens over at Hidden Brook, and at 9 o'clock, there will be a program for seniors, and we'll be doing chair exercises.
Oh, nice.
All 6 feet apart, all with masks, and there will be a nutritious, healthy snack that's offered. So we won't be cooking together like we have done in the past, but we will be able to offer a healthy snack and enjoy each other's company 6 feet apart and do some exercises in chairs.
I love that. And the tent program that Brandy is talking about is that one of our innovative ways to still provide services that we set up canopy tents throughout our community garden space. And so tents are well spaced, And we have partners who are there who can provide resources or classes, exercises. We have fresh food giveaway tomorrow at our Wednesday program. So there's lots of things there, and people come in and they take lots of safety protocols, of course, with social distancing. As we talked, everyone has to wear a mask, as we mentioned was important, and we take temperatures of people coming in, whether they're staff or partners or clients. And so it's a safe way to start reaching out again and providing those really essential services.
Right. So that also makes me think of our Girls on the Run program. I think many of your listeners will have heard of Girls on the Run. Excellent program that we also offer with your youth. Your ages 9 to 14 is usually about the age group. And Heidi coordinates that program with Girls on the Run. And girls are meeting. They've started this program. I think we're 3 weeks in. Social distancing, running together, and learning some education some empowering sorts of education for the girls that are participating in that program.
And can anybody sign up for that from that neighborhood?
Yes, so anyone can sign up. If you're in the Hidden Brook neighborhood,
which is in East Colfax area of Denver.
Right, Heidi has probably reached out to you if you have a youth that's within that age group. If she has not reached out, please come see us at 10 programming tomorrow. In the past, the Girls on the Run program runs a 5K together. And
nice.
We've had a group of young ladies that ran a 5K from that neighborhood. We are also getting ready to launch some jump roping programs.
I love that.
The youth are telling us, we're ready to get out. We want to do something. And so we've hosted jump roping before in the courtyard across the street where your playground is. And that was fantastic because your residents, the way your building is shaped, it's like a U, and your residents are able, your moms, your dads are able to cook dinner, be doing things in their apartment, and
still
watching while the kids are doing jump roping. And we had parents that came out. So if any of you are watching, you definitely have a superhero jump roping family on the 4th floor of the Hidden Brook neighborhood that came down and jumped rope with the youth as they were doing that. Our goal is to see 90 minutes of physical activity a week with the youth. And let me tell you, your youth are still doing it, even during the pandemic. They have been keeping in touch virtually, and we've had some virtual yoga classes and some virtual exercise classes. And now we're asking the youth to take on some of the exercising on their own independently and keeping a journal. And so your youth are getting 90 minutes of physical activity. They can do it in a journal. They can send a video of themselves doing it. They can text in a message. So if anyone at Hidden Brook is interested in this program and it's not part of the 90 minutes a week of physical activity, please come down tomorrow to tent programming and we'll get you signed up. And there's prizes once you reach certain numbers or certain minutes, certain hours.
So and we've got karate and also a bike group that's starting.
We do. Thank you for reminding me. We have a karate class that meets at 9 o'clock on Wednesdays, and we have youth within that program that have advanced in their belt, and you'll see many of your youth in gis, and I would encourage you to try have some of the youth teach you some of the things they're learning. They are quite impressive. And the bicycling was a great partnership. So Hope, as you know, was able to secure some bicycles, and the youth said, we would like some bikes. And so the youth are now owners of those red B-cycle bikes. And shout out to Tom in the Hidden Brook neighborhood, if you're
Tom
on here.
Meyer. Yeah.
Yes, thank you, Tom. He has made sure all our tires are pumped, and he repaired a bike so that Heidi could ride a bicycle with the youth. And last week we rode to an excellent ice cream store. I also encourage everyone to try it. It's at 11th and Syracuse. It starts with a W, and I can't remember the name of it now. It's at 11th and Syracuse.
Just go check it out.
Just go check it out. It is the best ice cream in town. And so our youth are now learning these bicycles can be fun, also a mode of transportation and a way to get places.
And good exercise.
Yeah, and helps them get to that 90 minutes of exercising. We also have patient navigation, and this is a partnership that works really well and demonstrates pandemic or pre-pandemic or post or pre-pandemic really encompasses and really defines partnerships and a strong partnership we have with Hope. And we partner with UC Health's their medical school's urban underserved track, and the medical residents and students are with us for a month and work with residents within the neighborhood that are maybe not accessing health care or need some extra help accessing health care. And that partnership goes back and forth with resident services and the medical residents and students and Project Shine all working together to make sure all of the social determinants or the reasons that you aren't able to access health care aren't because you don't want to, or it's often there's other things.
It's not always easy to navigate.
No,
So
it's
really,
so confusing.
yeah.
So it's great to have lots
It's been wonderful to have your medical interns there, or residents there.
They it's been great to have their expertise and also I think that they would say that they learn very much from the residents. So a shout out and a thank you to your residents for allowing this program to be there, because at the end of their month they reflect or they tell us what worked and what didn't work. And I'll tell you, the things that don't work are never anything that has to do with residents. And the things that did work were the relationships and the openness of your residents. And for someone that's moving into becoming a doctor, moving into the medical profession, to really learn from your residents is a gift. So a thank you to all the residents at Hidden Brook for allowing this program and allowing the residents to partner with them on their healthcare.
Thank you. Yeah, I think that's wonderful. I know that also that in the past, I think when I first got here, there was a program that might have involved some of the medical residents, but really we were also working with the Denver Foundation and helping people to learn how to advocate for themselves, and they wished to get light, but they were also working on a pharmaceutical issue with some of the pharmacies to get things translated.
Right.
And you were a big part of that program, weren't you?
We were. We had a partnership with Denver Foundation, and they had one of their community leadership strengthening community trainers come out and work with us and do weekly meetings. And yes, the community asked for the lights to be turned on in the park, which happened.
I love it.
We had worked with, we had a partnership or funding from Rose Community Foundation to work with youth that year to train youth to be community interpreters, not interpreters for healthcare or legal services. We know that those must be trained interpreters and not interpreters that you shouldn't ask children to, or anyone under age 18 to do that sort of interpretation. And so yes, that program, you probably had, Sharon, I bet we had 15 to 25 residents at every meeting. So thank you again. The residents like their neighborhood and they want their neighborhood to be better, and they're willing to put in the work. I mean, coming to a meeting every Wednesday or once a week, that's a lot to ask of people. So I think that shows the commitment of community and the commitment of community wanting their neighborhood to be a good, safe place.
We have an amazing resident engagement or client engagement at all of our properties. It's been amazing. We got a comment while you were talking that it's the Walla Creamery is the ice cream place.
Thank you. Yes.
And people are saying hello to you. So it looks like a great ice cream place.
It is excellent. I suggest everyone.
Yeah.
Everyone try that ice cream place. But that partnership with the community coming together and sharing their ideas of what they wanted to do to improve their community. You will still see, Sharon, I know you see it on Tuesdays and Wednesdays when the street sweeping happens. Sorry, Denver parking parking fines, they lost a lot of money because of that, because your residents have said,
That's awesome.
we are tired of getting parking tickets, and sometimes we forget. And so your residents put out a sign still because of those meetings on the street sweeping days on the street, and people don't park because it just reminds people. It's a lower signage. It's one side is written in a language, it's written in Burmese for residents to read, and it absolutely prevents people from parking and getting those parking tickets. So
they've been involved in safety meetings. We just recently had a safety meeting with the community, and we had several residents online as well, because we couldn't have everybody in the room. So that was great. I mean, they really care about their community, and that resonates with us, with our values and yours.
Right. Yeah. No, your residents are awesome. They absolutely care.
Yeah. So the COVID-19 really, threw everybody for a loop, but I think Spring Institute and Hope have been very responsive. The tent talks was one of the things, so there's tent topics that we do on Wednesdays to help get that service out there. But we also really collaborated a lot with our food service, which, I thank you so much for all the help when we were distributing food boxes, but you were there helping us every day, not only with our weekly food boxes, but with the school distributions.
Right.
So that was awesome.
Yeah. One thing I really, and it doesn't exactly answer your question, Sharon, but I really want to share, because you might have other community members on this call, was Spring was so grateful and honored to be part of an organization that recognized that serving the entire community was what was important, and there was no choice. And Hope never once, like through food distribution or anything, would say, we're only serving Hope residents. Yes, you have your Hope residents at heart for sure. However, you definitely recognize serving the entire community would make your community healthier as well.
Right.
However, that's not always the perspective, and it's very difficult during times like this to not focus on only serving the people that you traditionally serve. And so Hope really opened their arms and served that entire community. And from the very beginning, we worked with DPS schools, and so I don't know, you probably know the number, Sharon, but there were thousands of breakfasts and lunches.
Yeah.
And if Heidi were on here, she could give us the number. She gave me the number a couple weeks ago, and I said, Heidi, are you sure? That seems like we're not telling the truth. It's so many. But it was a lot. It was thousands of breakfasts and lunches, and Hope Community showed up. Your staff showed up to help deliver those lunches and make sure. And that was at the very beginning when this started. We knew that people, that we just wanted to make sure that the community's needs were being met. And one thing that children were sharing were, I'm not getting my lunches and my meals at school anymore. And parents were still working in the very beginning. And then I think, as things progressed and worsened, parents were home more. But in addition to that, it was an opportunity to see people safely, or see community members safely, and find out what the other needs were and respond to those.
Yeah.
So,
that's true.
So
and then we had about 100 food boxes a week for quite a while.
Right, and I think it was sometimes even more than that, of food boxes, with another partnership with Village Exchange Center to make sure that food boxes. But I think you were also excellent, and everyone working together was excellent in listening to the community and the foods that were more culturally appropriate, basically, in our houses.
Right.
The community was always grateful. No one was ever ungrateful for the food they received. However, there are some dietary restrictions, and let's be honest. And so it was fantastic to see families getting food that they would eat.
Yeah, I love that too.
Right.
Being really sensitive, but I really don't think any of us could have done it alone. That's one of those things where we came up with a creative, collaborative solution. Made all the difference in the world.
It did. And again, a shout out to the community, because your youth in the community came out and helped us deliver and helped text families and say, hey, this is where the DPS bus is today. And we had two community members that joined on the Denver Public Schools food. They had a virtual meeting about how to make sure we're meeting the needs of our students and their families. And they joined, and they had great suggestions on.
Right. And I called the head of the food service to
Yeah.
just talk about the culturally sensitive foods as well.
Right, and we did. We saw the food. They were very flexible, and that just it demonstrates again the partnerships and people's willingness to help. And I also think people's willingness to understand we're all learning as we go.
Especially now.
And yeah, and so there are things that there may be a hiccup, and the community is fantastic about being patient, and I think as community partners we continue to be and even learn more that you might make a mess and you can clean it up.
That's a great way of putting it. We don't have too much time, but I wanted to highlight some of the other partners that we've worked with really closely. And I don't know, I made a list. I have someone who's writing in the web addresses for these, so people could check them out. But would you want to go through and talk about what each of these groups do?
Right, absolutely. So Project Worthmore was there right at the beginning, and they delivered food, I want to say just right on day 2 of the pandemic, maybe day 1 or the day before. They also have a dental clinic, and they're seeing residents already. And I know for a fact you have some residents that are going over to the dental clinic.
Yeah.
So if anyone's watching and needing some dental work done, I know that Project Worthmore's dental clinic is open and seeing clients,
and they'll be there, I think, next Wednesday to take appointments.
Yeah. Oh, that's right.
At our tent.
Right. Yeah. APDC is also a fantastic partner.
And that stands for
Asian Pacific Development Center, and I know that they're still very active in the work that they're doing. Street Fraternity, we partnered quite a bit with them. They were, and I think still are, Sharon, offering food distribution on Thursdays.
They are.
And have community members that are volunteering and have been an awesome partner in making sure that they are trying to communicate with the police department to keep things safe and also make sure people have food. They also are an organization that serves the entire community, and we really appreciate that.
And they typically work with young men in the neighborhood, and it's a support group and a place for young men to go, young teens. And then Asian Pacific Development Center offers a lot of mental health services.
Right.
And then Right on Learning.
Right on Learning, also right from the beginning, was partnering with, once we had food and we partnered and we had the food situation moving along, it was time to get everyone a computer and connected to distance learning. And so Right on Learning has been at the tent programming and offers homework help, works with the older youth, and can do it virtually, and will also help in person in a very safe way.
And we have Brandy, who runs Right on Learning, coming to this show next week.
Oh, great.
And we are going to be distributing or giving information about specific programs, technology programs, how to turn on different types of computers, how to hook up to the school system, how to submit your grades and your assignments, because all of these things are not really intuitive and they're for someone who hasn't had technology available. So we're going to have lots of different little mini classes for people to take, and then Right on Learning will help us to reach out to parents too. So it's going to be great.
Right, and we will hopefully be able to partner with them too as school starts and parents make the choices on what they're doing for this fall. We have a projector and a big inflatable screen that will be able to project anything.
Yeah.
So we're hoping, if DPS is listening, to have maybe the assistant principal or a staff member from some of the schools that your youth go to, from the high schools within DPS, to give families instructions on what it looks like when school will start. So that's kind of a shout out to the innovation funding. And but also we are really excited because again, the shape of your building, people will be able to watch very safely from their windows, from their deck, or from their outside of their door, be able to watch whatever's projected on the screen.
So we're just going to quickly highlight, we also have the Denver Public Library Plaza program, and they've been at our 10 topics on Wednesdays, passing out books for kids, and they've been really helpful, helping people to stay connected. When the library's open again, we'll be able to use their computers, they'll bring them in more. Aurora Mental Health, we did have Allison here a few weeks ago, but they're providing lots of services, and they are Connect for Health Colorado broker as well. Can you tell us a little bit about the med school and the nurse program at UC or CU?
Right, so I spoke a little bit about partnering with the urban underserved track at the medical school earlier. We also have a very similar partnership with the nursing college, which is on the same campus but separate school. And currently we have 2 nurses that are working with us that also do our patient navigation, call and can check on clients, deliver medication. They can meet patients outside if a patient feels safer, doing that outside, and helping us connect people to healthcare, address reasons, and listen to patients on why are you not accessing healthcare.
That's awesome. And then the Nurse Family Partnership is a statewide organization, and how are they working with you locally?
Right, and I think I was talking about the nursing college that we work with. The Nurse Family Partnership works with expectant moms in the neighborhood, and if it's your first child here in the United States, they will offer you services from birth all the way up to 6 months. And so an excellent program for new moms or expectant moms in the neighborhood.
Great. And then Dr. Cog has a senior program. Right. And lots of partners here, great partners.
Yes, Dr. Cog has great senior services. So any residents that are listening or anyone that's listening that would like to look on the website, it lists a lot of resources for seniors. A specific example would be a senior that's living in the building that has their health is deteriorated and it's difficult to keep their apartment clean. It's difficult to continue living independently. And Dr. Cog swooped in and helped us find a cleaning service for a community member that helped maintain their apartment and keep it clean and allows them to live in their apartment longer. So
that's an amazing program. Well, I am so sorry that we're running out of time, but thank you so much for being here. Brandy and Spring and Stu both are just amazing partners. We love working with you, and of course we both bring in all kinds of other partners.
We do, yeah. So, well, thank you, Hope, and again, thank you for having such awesome residents. Well, I love to hear their ideas. We could not do it without the talents within that community.
Thank you. I will pass it on as much as I can.
Yeah.
So, as part of every Facebook show, we also share a book review, and we get people from our community, our volunteers, staff members, partners, you could do one, to do a book review about a book that they really admire, because we know a lot of people are reading more now during this downtime, and we try to find books that have the capacity to download from the Denver Public Library, because the libraries are not open at this point, and also not everybody can go to a bookstore or can order something online like that. So we try to get something that's downloadable, and if anybody would like to do a book review, you can reach out to me, or you can reach out to info@hopecommunities.org, and we would love to feature you. So the book review we have today is provided by a young woman who is a school-age person. Her name is Savannah, and she is the daughter of one of our board members. She is reviewing the book The Hate You Give by Angie Thomas. This book has just taken the world by storm. It's a young adult book. It highlights 16-year-old Star Carter, who goes between two worlds. She goes between the neighborhood, which is a poor neighborhood that she grew up in, and also the neighborhood that is in the school that she attends, which is a fancy suburban prep school. So there's an uneasy balance between those two environments for her, but she really she's just shattered when one of her friends from her neighborhood where she lives is killed. And so it's a fatal shooting by a police officer. It's a true story, but it's an all too familiar story now too. So please listen to Savannah's review of it. The book had over 6,000 reviews, and it's a 5-star rated book. So it's an excellent book, and it is available for download at the Denver Public Library. So I hope a lot of people will read it. But first, I hope you'll listen to Savannah's book review, which is so cute and really a great review. So thank you, Savannah, for doing that. So that's all for our show today. Please be well. Please make smart choices. I know I sound like a mom, but make smart choices to stay healthy. And a lot of that has to do with social distancing and masks. As tired as we are of that, we still have to keep doing that. So reach out to us if you have any questions, if you have any needs. We would love to help you. Send us an email at info@hopecommunities.org, and we will do what we can to make your life better. Thank you again, Brandy.
Thank you, Sharon.
Thank you all for joining us today. Bye.